for doing that. And we also want to thank our SOARs who are monitoring the chat through our Zoom so that we can address all of your questions. Please continue to put your questions in the chat or through Facebook, and we will continue to monitor that and answer them as we move forward. I think we're ready, everyone. Right?
Yes.
Perfect. One of the things we want to let you know is that we have a bit of a disclaimer. We're going to be putting this disclaimer out throughout our process. The disclaimer is this: keep in mind that the information being shared today is an overview of COVID-19's vaccination and the registration process. For medical information, please contact your doctor or medical healthcare provider. Again, for medical information, please contact your doctor or medical healthcare provider. So with that, let's get started. Many of you may be familiar with an organization known as the Black Coalition Against COVID. And so this organization, which will drop the information and the link for you, has various details and information as it relates to COVID-19. One of the things that we want to start off tonight with is just giving you a lay of the land and really establishing the foundation. So up next, we're going to start off with a love letter to Black America. Take a look.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/loveletter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
That's great.
That was great, huh? Yeah. So we wanted to set a tone and to just share that with everyone. So as we move forward, again, into our 3 levels and our 3 chapters of our conversation today, we want to start off in our first level by talking about the vaccine itself and explaining what that is. We want to welcome to our conversation at this level, Jasmine Long. And I want to just introduce Jasmine and then she'll get started in a few seconds. Jasmine Long is a follower of her Lord and Savior, Jesus Christ. And she was raised on the southeast side of Canton, Ohio. She's happily married to her best friend, Ross Long, and they have 3 children. Jasmine is currently a third-year medical student at Ohio University Heritage College of Osteopathic Medicine in Cleveland, Ohio. She is a Stark State College alumni and holds a Bachelor of Science degree in Public Health from Kent State University. Jasmine is passionate about showing the love of Christ through medicine, health education, advocating for the underserved, and improving the health and wellness of individuals that reside in underserved communities throughout the world. We want to welcome to our conversation today, and it is a pleasure to have you with us today, Jasmine. Thank you so much for talking with us today about the vaccination process. And for what we understand, you're going to describe for us not only the process itself, but how the vaccination was developed and what it is that we should know. So we'll turn it over to you right now. Thank you.
All right. Thank you. Thank you all for having me. I just want to thank the Stark County Alumni Chapter, Delta Sigma Theta Sorority, for having me this evening. 1 second, and I'll start sharing my screen and we'll get started. So we're going to talk a little bit about vaccines today, particularly the COVID-19 vaccine, but I kind of want to walk you through the process just to kind of explain things a little bit more about vaccines and how they work. So the first question is, what is a vaccine, right? So the Centers for Disease Control and Prevention, the people that kind of roll these things out, those topics, I'm sure you heard CDC in the media a lot. So they describe a vaccine as a product that stimulates a person's immune system. It produces immunity to a specific disease. It protects the person from that disease, and it's very convoluted. So let me break all that down. What does that mean? Because I like to explain things in layman's terms. So let's start with, what is the immune system? So you hear about, oh, you need to boost your immune system, but what does that really mean? So if you look over here on the other side, I'm going to change my pointer here so I have my laser pointer. You can see here that this is the immune system. So inside of our body, it's a network of cells, tissues, organs that fight germs that get into our body. So you name it, if it's getting into your body, the common cold, your immune system is going to fight. And it consists of these lymph nodes here and the lymph vessels and all these organs that you see on the screen. The key thing that you need to know about your immune system is that it has memory. So it can remember what germs you come in contact with, so that in the future, when you come in contact with those germs again, your body can fight it off at a quicker and faster level, rendering you less sick in the process. So what does all that mean? Memory cells. So let's say you get chickenpox, for example. A lot of us have had them in our childhood, and say again in the future you run into chickenpox. Well, what's going to happen? Well, what happens is these memory cells, when you get in contact with a virus, because chickenpox is a virus, what happens is your body remembers it. So it finds that germ, that chickenpox virus inside of your body, and it says like, hey, who are you? You're not supposed to be here. You're not one of the cells that's usually in the body. And they attack it. But after they attack it, they basically make America's Most Wanted poster of the chickenpox. That's what your immune system does. So if they see that person again, as they enter your body, they see the chickenpox, hey, that's the guy that's on America's Most Wanted poster. Let's attack him because he's not supposed to be here. So that's the key thing about our immune system, is that it has memory. No brain, but has memory. God is amazing. That's all I'm going to say. So the other thing is that it's going to be a quicker response. So chickenpox is going to produce, it kind of produces those bumps on your skin, you get a fever. The next time you run into it, since they remember it, you're not going to have any of those reactions because they already know that they need to fight it before it even causes those symptoms that we know that chickenpox causes. So what does all that mean with vaccines? So knowing that our immune system has memory, let's go into how vaccines work. You guys still with me? So a vaccine can be 3 different types. And this is kind of less important, but kind of important so you know what you're getting injected into your body. So you can have a live vaccine, you can have a dead version, or you can have a fragment or a piece. So if you look to the screen here on the right side, a live version is this. If this is COVID-19, let's just say this is the virus. We've seen kind of what it looks like. It's a ball with different spikes coming out of it. But the inside here, that's the genetic material. So what they can do is they can kind of take a part of this, basically kill it, putting heat on it. That's how you kill a virus, typically, is with heat. So they'll heat it inside of a lab, take out the bad part of this information that's going to make you sick. So if we're talking about COVID, they're going to take out the stuff and that genetic information that's going to cause your coughing, that's going to cause your pneumonia, and all those different things that we know about COVID. They're going to cut that piece out, kill it with heat, and then inject it to your body. That's enough information for your body to say, hey, what is going on here? Let's attack it. So you're not getting the cough and the pneumonia that you get with COVID, but you are getting that same information so that your body recognizes it. That's the key thing. You want to recognize it. So then in the future, say you are out and you are exposed to the real COVID, then your body can say, hey, that's COVID. Again, America's Most Wanted poster. Let's attack him and let's get him before all the other symptoms come about, because that's the whole thing with COVID-19. It's the symptoms that causes, basically, it's the illness. And then that's what causes all the adverse side effects that you hear about and all the different things in the death that is caused by that disease. So there's the live version, there's a dead version where they totally kill it and inject it. And then there's a fragment where they would take a piece of, let's say this here, this is kind of like a protein that came off the outer surface of the virus. And they'll mix this with different things, inject that into you. And even that little bit of information is enough to know, hey, if we see this protein inside of the body, America's Most Wanted again, it's on that poster, attack it and get it. And that's going to happen faster, basically making sure that you're not going to be as sick as you would have been if you've never encountered it before. So the key point we want to remember here is that our immune system has memory. So your body, that immune response that they're talking about, when you receive the COVID-19 vaccine, they're going to inject it into you. It's going to go in there and your body is going to say, what is this? It's not one of our cells. Let's kill it, but let's remember it if we encounter it again in the future. So on the right side, this is your blood vessel. Your blood vessel inside has a lot going on, more than you would ever imagine. And this is just not even a third of it. But you see the cells here. The key thing is the white blood cells. That's a part of your immune system. They're the ones that are remembering what's going on. And then they make these cool things down here. So if you look down on your screen, let's say this is COVID-19. These are the proteins that they're talking about, the antibodies. This is the memory. So these things are going to attack it and kill it a lot faster. And then that's why you're not going to get sick from it. So when they inject you with the vaccine, it has the same information as COVID, minus all the sickness that you get from COVID, the cough, the pneumonia, everything else. But your body can remember it. So when you do encounter the real thing, like I said before, your body's going to know what to do and you're not going to get sick, or at least less sick than you would get if you had no encounter with it before. Let's talk about the process of vaccination real fast. So the key thing to know about COVID-19 is that it went through every single process that every vaccine that we know about went through. The flu vaccine, the chickenpox vaccine, measles, mumps, and rubella, all those vaccines that we know about, they have to go through the same process. So it's not less safe than anything else. It's FDA approved for a reason because it goes through a different process. So you have phase 1. That's when you have about 20 to 100 healthy volunteers. What they're going to figure out in phase 1 of vaccine approval is the vaccine safe. Is it just going to make you pass out and just, I don't know, give you stomach cramps right away and just render you just vomiting for hours? What's going to actually happen? So they want to make sure it's safe. And they want to make sure it works. Will it actually produce memory? Will your body remember to basically protect you from the disease in the future? That's what they want to figure out. Then phase 2, they're doing the same thing. So they want to know, what's the most common side effect now? So we know it's basically safe. We're going to add some more people. Is it giving them a headache? Is it making them have diarrhea for days? Like, what is happening now? So they're still keeping that information. Then we're going into phase 3. Same thing. Now we're just adding more people. Still, at every phase, we're saying, is it still safe? And then we still want to know, what are the common side effects? So every vaccine goes through this, and COVID-19 vaccine is no different. This is the phase that's not on the slides. This is basically phase 4. Every single vaccine that is injected to our bodies is always in phase 4, because we always have to make sure that things are constantly safe. So you'll see the vaccine adverse event reporting system. They're going to report any adverse event. So if people are having, and none of these things are happening, but if everyone's big toe is turning blue from COVID-19, that's going to be reported. Everyone's getting this reaction so that they know how to improve it in the future. So The last thing I kind of want to talk about is the COVID-19 vaccine itself. It's an mRNA vaccine. It's not the live and all the other things I explained to you. And you're going to hear these buzzwords, and so I'm going to break it down just real quick. So the mRNA vaccine contains information that will allow your body to basically remember it. So if we go back a few slides real fast, because I'm a visual person and maybe this might help some visual people in the audience. We're taking a little bit of that information, but we're going to take it, and when they inject the COVID-19 vaccine into you, they inject, say, information to make this protein right here. Your body is going to make it, and then they're going to see it, they're going to remember it, and then they're going to basically make those antibodies that I showed so that it remembers it. To break it all the way down, let me give you an everyday example. I love my brownie sundaes. I actually had one earlier today, but this is how to explain it. So we know to make a brownie sundae, right? We need ice cream, we need whipped cream, we need cherries, and we need the brownie. Well, knowing all that, I need the recipe to make the brownie because the brownie is a part of the sundae. So if COVID-19, the virus itself is the sundae, I am making the brownie. So we're just making a piece of the brownie. And let's say they're basically injecting, if you will, the brownie into you. Not the whole sundae that's gonna make you sick, just the brownie, just the recipe to make the brownie. So the COVID-19 vaccine is basically injecting the recipe to make the brownie. Your body is remembering what the brownie looks like after your body makes it. It goes on that America's Most Wanted poster. And then if you encounter COVID-19 in the future, your body knows to attack it a lot sooner, and you're not going to be asymptomatic, which means you're not going to get the cough, you're not going to get the pneumonia, and if you do, it's going to be totally decreased what you would have got if you didn't have the vaccine. So you're going to have less symptoms and be better off because your body is prepared to fight the virus because they know that that's not supposed to be there. So right now, there's 3 different phases that Ohio has for the vaccination process. I think that we're going to kind of talk about that later on in the program. But right now, we're just in phase 1. The supply is limited. We got to take care of people that are taking care of COVID. We got to take care of, those that are at risk in our population. So here's the different dates. We're currently still in phase 1B. As of now, we're beyond February 15th. So everyone here, if you're reading this, 80 years and older, 75 years and older, 70 years and older, 65 years and older. Basically, if you're 65 years and up, please get the information and get vaccinated. If you know someone, contact them, get them the information. And then they even have people with specific conditions. So the one thing I will say, since this is kind of more African-American communities, if you know someone that has sickle cell anemia that's even 16 years and up, they are eligible to get vaccinated. So if anything, if you're not sure if you're on this list, call your doctor because they will know for sure if you qualify and they can give you that extra information that you need to make sure that you get vaccinated. So here's all my sources here. I use legit sources with what I do because it's not just me coming off my head with this information. And thank you all. I hope this was helpful for you. And if you have any questions, feel free to, I guess, are we putting those in the chat or however we're being directed to do so.
Wow, Jasmine. So aside from the Sunday part, which I think most of us understood that was a really good explanation. Most of us love our desserts. One of the takeaways right now, what we're hearing from you is that this is really about memory. And basically, because our bodies remember things, we're actually getting a fragment of this so that our body will remember it so that we can have enough antibodies to fight COVID if we're ever attacked with it. So our body will remember. And that's really what that vaccination process is about. Am I kind of creating a good summary for you?
Yes, that's exactly it. That means you got it. So I'm so excited to hear it. Yes, that's exactly it. And then I will just add that it's kind of like the flu vaccine. Right now, we don't know if COVID is seasonal or not, but you're just basically getting your doses now, and you might need that booster every year. You get a booster every year for flu. That's what you're getting. When you get your flu shot every year, you're basically just getting the flu vaccine booster. So you might have to do that with COVID as well. But yeah, that's exactly how it works.
So as we're going to pause and take some questions from this, because I think what happens is folks aren't quite sure how a vaccination's been created. And so what you've been able to do is to break this down to say, this is how vaccines are approved. This is the process. And so we've gone through the approval process. So that's why the vaccination process is now happening, because we've gone through all of the steps, I'm using air quotes, the steps that we're supposed to be taking legally for this vaccination to be approved. And so I think what is also interesting, which I'm not sure if people knew this, or maybe folks who are joining us do know this, is that list that you provided. Can you go back to that list of other conditions? Because that was something new. Go back, right there. Yes, right there. And just kind of walk us through that list again, because you showed it, but it talks about specific qualifying conditions. And if you can just explain that again in terms of, if someone has this condition, they do qualify to receive the vaccination in spite of the fact that they might not be 65 or older. Is that correct?
Yes, that's correct. And for brevity's sake, I didn't go through it, but since we have time, that's fantastic. I would love to go through this list. So sickle cell anemia, basically what you're going to see on this list are things that people are born with, what they call, basically just congenital symptoms is the proper term that they would use. So if you're born with these things like sickle cell anemia, you're born with the sickle cell gene. So that's why your cells are sickle. Down syndrome, you're born with Down syndrome. Cystic fibrosis, you're born with that. Muscular dystrophy, you're born with that. These are all basically genetic conditions. So you're going to know if you qualify because they manifest themselves very early and you're going to know exactly what it is. Cerebral palsy is kind of one that we're kind of familiar with, but not as much, but that kind of happens more in our communities. Spina bifida is another one. And these are all pertaining to either the cells or just neurologic conditions. So like I said, the people that have these congenital conditions, they're going to know exactly. They're going to know that they qualify. Severe heart defects. That's one where it's kind of, a little bit of a gray area. I would definitely call my doctor and say, what does that mean? So say you're, 16, because it has to be someone that's 16 and older, which we know because they haven't studied this in the younger population yet. Mm-hmm. So they have to be 16 and older, but a severe heart defect can be a lot of different things. So if you got a heart murmur and you're over 16 or someone, tell them to reach out to their physician because they could definitely qualify. Mm-hmm. Type 1 diabetes, call and ask what your type is. Typically what we see in the adult population is type 2 diabetes, which we're more familiar with, but type 1 diabetes is a genetic condition. So if you're not sure which type you have, which most of them kind of know because it kind of starts earlier, around like 11 years of age. But if you're not sure, call your doctor just to make sure. And then I think the key thing is who has been also hospitalized in the past year. But I say just call to make sure that you're not missing out on the opportunity to get vaccinated. These are very rare. So PKU and Tay-Sachs, you're going to know if your child has those because a lot of them don't even make it to beyond 30. So you're going to know. Epilepsy, seizures, that's another thing. That's kind of a gray area. Call. If someone's 16 and older and like, hey, they might qualify, call them. Turner syndrome and Fragile X, and these are you kind of know as well. But and then asthma is kind of one that's like, it kind of sneaks in there. A lot of people have asthma. It doesn't have to be severe, crazy asthma that, if you had to go to the hospital just for a breathing treatment, then you qualify. Mm-hmm. So it's kind of like when there's gray areas and you're kind of like, I'm not sure, it's always best just call your doctor because they're going to tell you like, yes, this is what you have. You definitely qualify. And then hopefully give you the information from there because your doctor should be a resource for you. That's what they're there for, to take care of you and provide resources for you to have information to take the best care of yourself. These other two are kind of alpha and beta thalassemias. These are kind of blood conditions, more in a Greek population, not as much African-American, but hey, if someone's out there and you're listening, call to whoever, if you feel like any of these things. And then the one thing we're also familiar with is organ transplant. So if you know someone that had a kidney transplant, any organ transplant that you can think of, you're automatically a candidate because more than likely you're on drugs that are going to decrease your immune system, which makes you kind of a little bit more susceptible to getting kind of those bad reactions to the COVID-19 virus. So if you're a candidate of any organ transplant any time in your life, you definitely qualify to get vaccinated.
So thank you for walking through that list with us because again, this is something that may be new for our listeners as they're looking at this. This is something that might not be out there and readily available. Now, we do have a question, and we're going to just pause and take some questions really quickly for you, if you don't mind. If you could stay with us for a few more minutes. One of the questions that we have listed here is, if you were positive for COVID-19, do you need to wait 90 days or 3 months before getting the vaccine? I think that's something that people aren't quite sure about. And if you're able to answer that, Jasmine, that's great. And if not, we can also direct people to their medical provider.
Yeah, no. And I would absolutely say that you are eligible to get it. You basically want to make sure, the data I've seen on the CDC's website is that you want to make sure you're not actively symptomatic. So that means that you got COVID maybe last week, but you're still kind of coughing, maybe got some pneumonia going on, still have a fever or an elevated temperature. You just want to make sure you don't have those symptoms. Anytime you're kind of out of that period of like the sickness from the virus, then you're pretty much safe to go ahead and get vaccinated. It's just like the flu vaccine. You wouldn't go into your doctor and your doctor wouldn't give you the flu vaccine if, say, you are currently have a cold and you have a fever, because then that's just overload for your body. It's just kind of like a lot going on. You kind of just want to, allow the body time to heal from what it's currently going through before you rev it back up again. So I would say just make sure you're not, according to the CDC, you just make sure you're not currently like sick with the vaccine. But anytime after you're no longer sick, so at least give yourself maybe, a 7-day window, then you're safe to get it. And even if you've had COVID, you still want to get the vaccine. The research that I have seen, again, from the CDC, is that they're not sure if having it the first time creates the immune response that the vaccine does. So just because you had COVID, that doesn't mean you're going to have basically the same immune response as if you had the vaccine injected to you for whatever reason. But it's definitely worth getting it, the vaccine, the COVID-19 vaccine, if you've already had the COVID-19 virus.
Okay, wonderful. Are there any other questions? We're going to check our chat here real quick as we shift our screens. Any other questions that we're seeing and posting? All right, we got some thank
We
you.
have 2 other questions in the chat.
All right.
One is the vaccine that they're offering now, is it alive or is it dead? The 2. And the second question is, what is the difference between the 2 vaccines?
Okay, yeah. So the first question, is it alive or dead? So if we go back to that slide real fast. So COVID is actually, it's a fragment actually. It's a fragment vaccine. So when I mentioned that brownie sundae, basically, if you see here, this is kind of the surface of the virus. And so they're just taking like this little guy here on the surface, a protein. And they're basically making the vaccine from that. So just this little virus. So it's actually a fragment vaccine. It's a little protein. They mix it up together and then they do their thing, scientific thing, and then they inject it into the body. So it's actually a fragment vaccine. It's just a piece of the virus, and it's not live or dead. You're not getting any of the genetic information of the virus. You're just getting a piece of it. So kind of like the protein. So it'd be a fragment virus. And then the second question was, what's the difference between the 2 vaccines? Meaning, is that referring to Pfizer versus Moderna, or?
The question was, they know that there's 2 vaccines and they don't know which one is better than the other. I guess they're just trying to figure out is there a pro and con to either or?
Okay, yeah. I would say, honestly, it's just 2 companies. So it's kind of like, do you want to buy, I don't know, Dove deodorant versus Degree deodorant? They both work. It's just 2 different companies making the same thing. I will say what I've heard, and I can get back, but one isn't better than the other, although they're saying that, so with this, basically they're seeing new strands. That's a whole nother thing in itself. Basically, to make a long story short, is this is the COVID strand that we're used to. This is the virus we know that's making everyone sick. Well, now it's starting to change a little bit and it's starting to look like this. And they're saying that Pfizer is actually a little more, I guess, potent to the new strands that may be coming in. But either way, regardless of where you go, whatever is available to you, just accept it, because you want your body to basically build up that memory to know what they need to attack. So honestly, on this level right now, one is not better than the other. Just get vaccinated. And then later on, as that information comes forth and kind of evolves more on the scientific realm, then they'll get back to us and they'll produce a booster that does target that new version. So either way you go, you're going to be safe. And there's really no key difference, honestly, at this point.
Okay.
So we have one other question if we have enough time, Krista.
Yes, we do. Go ahead.
The last question was, is it absolutely necessary to take both shots? And what is, if you don't take both, what is the outcome of that?
So according to what some of the research is saying is that one shot will at least give you, and these numbers are approximation. I mean, if anyone wants exact numbers, I can definitely look it up and get the information so that they can get it out to you. But the one shot will give you at least roughly around like 50–60% protection. And then the second dose will give you like around the 90% protection. So what that means is, yeah, you're going to have a little bit of immunity, but you want that booster to really be able to protect you. You want that second dose. So basically they're injected inside you. Remember, we're making the America's Most Wanted poster. And then when they inject it again 28 days later, it's like, this guy is really wanted. Like, it's kind of like, oh, they're still on the list. Like, let's really attack. Like, why is he back again? He's really wanted. We remember him. So it just allows your body to be like, okay, now if we see him a third time, we just gonna get him as soon as we open the door. Basically how it works.
Wow. Wow. So Jasmine, again, the key takeaway, and if we can put this in our chat, is that while you might be thinking, I only need the one shot, you really need that second one, that booster, because those two are combined. I'm thinking about Wonder Twin powers activated or something that,
yes, exactly.
That strength of both, that this will really help to fight that virus. And it also will create that memory, as you've been reminding us, that memory that we need to fight the virus again. So
yeah.
This is wonderful. Thank you so much for giving us that explanation of the vaccine and just walking us through that process, because this is something that many of us, this is just not our world. We don't, this is not the world we dabble in, but we thank you for just peeling back that cover and that layer and giving us a sneak peek behind it. And again, we want to remind our listeners that the information shared is an overview about the vaccine. And also we're going to be talking about the registration process. But what we want you to know, if you need medical information specifically about this as it relates to your healthcare, please contact your doctor or your medical healthcare provider. Again, please contact your doctor or medical healthcare provider. So Jasmine, thank you so much for the explanation, the vaccination one-on-one. I think it's been memorable for all of us. And for some of us, we're going to remember the brownie piece. I think we're going to remember that most of all. So thank you so much. Can you stay around for a little longer in case we get some other questions?
Absolutely.
Wonderful, wonderful. So up next, everyone, and we just are thanking you so much for continuing to join this conversation with us. We have more coming up. Up next, we're going to talk a little bit about the registration process. Again, if you remember, when we started this conversation, we said we have 3 layers we're building on. The first layer, which was our foundational, our layer, which is understanding the vaccination. This next layer that we're going to add to this story is talking about this Stark County registration process and understanding what it is and what it is that we should be doing, what we should know. And so with that, we want to welcome to our conversation one of our sisters who's going to be helping us explain this process, Cleo Lucas. She is also a board member of the Canton City Health Department, and we want to thank you, Ms. Cleo, for joining our conversation today. Now, what we understand is as a board member of the Canton City Health Department, you've been working really closely to see the behind the scenes of the registration process. And we also understand that you've been on the front line with seeing this vaccination being delivered and distributed out and given to fellow citizens within Stark County. So we're happy that you're joining the conversation today because you're going to be able to walk us through some of the things that we thought we know, but you're going to help us get better. So thank you.
Thank you, Krista. And it is quite a pleasure to be able to share this information because a lot of times we make our decisions based on the wrong information or not the complete information. So I am excited because Restart Stark, they have a joint project with all of the county health departments, and they are putting together a complete website. This is a new tool for the registration process because we have talked over and over about why the process is so difficult. And what they've done is put it all together under one website that you can go in and register someone. The slide that Krista is showing now, if you could read that there, it says Stark County is classified a level 3 public emergency. And level 3 just means it's very high exposure and spread. So the highest level you can be is 4. So we're at a number 3, which only emphasizes what Jasmine talked about, how it's really important for us to get the vaccine. As we go through this, it's important for us to see how simple the process is. Krista's going to scroll through and I'm going to register myself again. I've already had my first vaccine.
So you're going to tell me if I'm doing this correctly. So I think you want me to click on here.
Nope, just at the bottom where it says registration process. I mean, scroll down. Yeah, right there, vaccination process, resources. Yes.
All right. So I'm going right here. Everybody's seeing this live demonstration. It's happening right now. In case you're familiar and you're saying, I don't know how to do it, we're going to walk you through this right now. So this is live. It's happening.
While she's going through that, it's important for us to know that those who meet the criteria, what Jasmine talked about, 65 years of age or older, and then she also talked about some pre-existing conditions. If you meet those criteria, then you need to register with an appointment at your health department. Each jurisdiction is handling the process a little bit differently, but I went in and I registered at all 4 of the health departments just to make sure the process was easy and very user-friendly. If you are a resident of Alliance, Canton, or Massillon, then you will use your city health department. And in this page, you can just go past that because Chris, you can, people, when they go in, they can look at that and it basically talks about the different phases. But with when they ask the question, where do you live? And you say Canton, they say, well, who picks up your trash? And if you say the Canton City Sanitation Department picks up my trash, then that's the health department you're going to register with. Just stay right there one moment. And if you don't live in one of the city health department's jurisdiction, then you reside in one of the townships, villages, the city of Canal Fulton, the city of Louisville, or the city of North Canton, then you will use the Stark County Health Department. So it's really easy to remember. If your trash is picked up by the Canton City Sanitation Department, then you're going to register with the Canton City Public Health Department. If it's picked up by the Alliance City Sanitation Department, that's who you're going to register with, or the Massillon City Sanitation Department. They go by where your trash is picked up, and that means where you receive like all of your city sanitation and everything from your water. So if you don't have that picked up, then you will go through the county, and all of their processes are pretty similar. So if you will click, there's 2 things that you're going to see. Let's do Stark County. Let's do Canton City, because I already registered, and I'll go and have them take out my name.
All right.
But,
So I'm going right here.
There's 2 things that you will have. You will have, like, you can click on online registration, or you can call. And that's going to be part of my spiel later on about you helping someone register. Let's click on online registration. And that just gives you the information. And it also lists some of the conditions that Jasmine already went over with us. So, things are being repeated over and over so people can get the information. Can you continue to scroll down? And these are the questions. Simple. I certify that I am a resident of Canton City and that my trash, remember I told you that your trash is picked up by the Canton City Sanitation Services. Let's click yes.
Okay.
And then I certify that one of the conditions below is true. I am 65 years or older. And that's the whole group that that the vaccine has been given to now. And please enter your first name. You can go on, enter my first name. And my last name. And my address, 805 24th Street, Northeast, Okay. And you put Canton, number 6. And your zip code 44707. I'm sorry, 447114, 44714.
Now, really quickly, just so people know this, when they're seeing these asterisks, these red asterisk marks here,
You
this
have to
means-
answer those.
okay, all right. Just want to make sure people know that, oh, I want to skip over that. They can't skip those things.
Right. And I don't go in and use that calendar. I just put my birth date in 2/14/1950.
Oh, well, it
Just
just,
type it in.
oh, okay, well,
Yeah, I just type, yeah, that's all I do. Don't put 21. That, yeah. We've had people that have been -1 because they typed in this year.
so when you do that, so here's the thing, if you clear this and you try to put it in, okay,
It types it in for you.
it does, you just have to be really clear. Okay, 214,
1950. You got to put the whole thing in.
okay. So that's the other piece. You have to
And then
put
you use
full-
close.
and then you just hit close down here.
Correct.
Okay, so just so everybody's clear, so I'm typing this in and it automatically went to the calendar, but you're going to have to hit clear and type in your birth date. Again, you need the month, the day, and the year, the 4 digits for the year. Okay, thank you.
Thank you. Now this, I usually don't fill in for people because all of the people that I have registered, they cannot just drop whenever they have like any excess of the vaccine available. They will call you if you want to be on a waiting list. So I always do know because most of the people are elderly and I just always have them have a specific appointment and not just be on a waiting list. And the way that the waiting list is developed, if they have X number of vaccines and suppose there's some no-shows. And if there's some no-shows that day when they're doing a vaccine clinic, then they will look at their, and they call it their, I think they call it their waiting list, a standby list. They call it their standby list. And they will choose and call people and say, if you can be here within the next 15 minutes, 30 minutes, we have a vaccine available that you can take today. Most people don't have that flexibility in their schedule.
Mhm.
Everybody that I've registered were like 65 and older. So I always click no. They don't want to be on a standby list. They want a specific appointment day and time. Okay.
Okay, all
And
right.
then you enter your phone number, 330-323-8338.
Okay,
And that's required. Your email address is not required, but if you put in your email address, they immediately send you a confirmation that they have received your registration. They don't
So-
use your email address to send out anything else to you other than information about your vaccination.
so if I don't put my email address in, someone will contact me.
Yes, you'll
Because I
get
left my phone number. And is
Yes.
it best to leave my, so whatever the best number is, I should be
Best
putting
number.
in under number 10, correct?
Correct.
So if that's your mobile, your cell phone number, you should put that in. If that's your house number, you should put that in. Whatever that number is, folks, put that best number in. But for folks that want that added assurance, they should go ahead and complete number 11, which is the email, so that they can have a record. Because I'm curious to see what happens when I hit submit, what's going to happen. That's what I'm curious.
Put my you go and put myself, if you want to put my email address in, Airstein1.
Oh, okay.
And see, I'm going to get another confirmation, but I will call, I'll be up, we're having a board meeting tomorrow, so I will let them know.
Okay.
I want to take up another slot.
Okay. Is that it?
att.net, att.net.
Okay. So you can still fill that in and then we hit submit.
Correct.
Okay. So that's what they'll see.
Right. Regardless, if they put in the, if they put in their email address or not, they're going to always get a thank you. And then what's good about this, when we get to the second part of just saying what is our response or what do we want you to do? What is the challenge? What am I asking you to do? You can get a list of people and then you just keep registering them. You know, you get all their information and then you just keep registering them. And Diane's going to respond to this because she's been doing a lot of registration. So you just click, you know, submit another response, click, submit another response.
Got it. Okay.
Okay.
Okay. And so an email should come back to you, right? Because you put your email address in. Is that right?
Correct.
Okay.
Mhm.
All right. Just wanted to make sure folks are clear about that. So this is what they're filling out if they're living within the city of Canton.
Correct.
This is the form that they would fill out. But if I did not live within the city of Canton, I would have, and I'm in Alliance, let's say, then I could still go here to the online registration. If you don't mind, I just
Absolutely.
want to click on that for folks. And you'll see here that they have a bit of a questionnaire as well that's listed. And it looks like you would just complete their information as
The
well.
same questions almost with the red dot. That means you have to submit that information.
Okay.
And even in Canton City, we have done one of our clinics at Lehman Middle School. I think that day we may have vaccinated over 800 employees for the school. So each school district that if you have, each health department, if you have a major school district within your jurisdiction, then you have had to set aside X number of your vaccinations in order to get them vaccinated.
And what if I'm in Maslin? I just want to, while we have you with
Just
us.
click on that one too. I did all of them.
Okay, so in Maslin, so Maslin is saying here, this is their, it says wait list. So it already says wait list, which is a little different. The other ones didn't say the words wait list, but it looks like it's asking for similar information and you just hit submit.
Correct.
Okay, and then,
And I have registered people for Alliance and for Maslin. And Maslin's, even though it said that wait list, they were called within that week and they've already received their vaccination.
okay. And then Ms. Cleo, what about this one? If we click on Stark County Health Department, should I click on that? Okay.
Yep. But no,
Oh.
I'm sorry. I thought you was going to do, that's just talking about, okay, just go down. Yep. Online registration.
Okay. And this looks similar. No, there's the trash question again, right? You
Yeah.
said. And then this looks similar to what we
Yeah.
saw with Alliance.
Absolutely.
Okay. So from one of our takeaways, if we could put this in the chat, Don, is that the forms are all very similar.
Absolutely.
In terms of what they're requesting of you. And that when you put your email address in here, it also will have a link here because we're looking here at this one. It says email. We may be able to provide you a link to self-register when it's time to schedule your appointment. So while it's okay to put your phone number in, it also might be helpful if you do have a working email to put that in there as well. Is that correct, Ms. Cleo?
That's correct.
Okay.
You get an immediate response when you put your email in there. So I think that's one of the plus, and I'm going to talk about that.
Okay. All right. So that walks us through our process, which is amazing because I don't know if we've ever done a live registration process like that.
Another thing that you will see on that website for, if you continue to scroll down, it does have a list of other sites for vaccinations, but I've never used them.
This here?
Yes.
Okay.
And it talks about other providers. And it's a complete list there that you could call them. Some people have done that and have been successful. A lot of people who I've talked to are still waiting for them to give them a call back. So I am only recommending using the 4 health departments, but you can see that there's a complete list there. You can even register online using their link.
Mm-hmm. And the links are right over here too. And those are hyperlinked and you can click right on them.
Absolutely.
Okay. All right. So, oh, sorry, go ahead.
No, that's it.
Okay.
Is there any questions?
So what we're going to do right now, thank you. We're going to pause right now. I'm going to stop sharing. We're going to pause right now and see if we can take any questions from anyone. Any questions that are out regarding this process of how you register. And we're also dropping in the chats also some information for folks. And I'm just checking here to see if there are any questions from anyone. Any questions, Dawn, on your end?
No questions on my end so far.
All right, thank you. I also dropped in the chat for everyone just that additional link in terms of responses and resources. So that's something that we can send folks back to continually if they are continuing to register. So thank you, Ms. Cleo, for taking us through that registration process. It didn't seem that painful at all.
It's not.
It didn't. It seemed very easy. But one of the things we want folks to remember is all of those things that have that little red dot by it, you have to answer all those questions.
It won't let you move on. It will not let you move on to submit. If there's anything with a red dot that you have skipped, it's really user friendly. And from my sorors, if I can do it, anybody can do it.
Okay. Wow.
Krista, before you move on, we do have one question.
Okay.
And the question is, if you are not 65 and older, but you go in and you want to register to be on the wait list. So in order to be on the wait list, I guess the question is, do you have to be 65 and older or have one of those pre-existing conditions, or does it matter?
And I don't know the answer to that. When people have asked me if they don't have one of those pre-existing conditions and they are not 65 and older, and they said, well, can I still go on and register anyways? I said, you can do that, but when they look at your age, you're probably not going to get a call back or get registered. And I don't know what they do about putting you on a wait list if you don't meet any of those qualifications. I don't know that answer. I can ask that. I'll ask that tomorrow, and then we can get back to people.
Okay.
Thank you.
Thank you. So we'll be posting that information. So again, these are all great questions. Keep the questions coming. This is why we're having this conversation. We've been asking, what is it that we should know? What are some of the things we need to tell folks about? And so that's why we're having this conversation today, because again, this is a call to action for all of us to be aware so that we can advise our family and our friends about the vaccination. We can advise them about the registration process. We know that folks have been struggling through this registration process, but you saw it here today live, a live demonstration where we walked through this registration process and you saw all of the different sites and they all look the same. So if there's anything that we can continue to do as a community to, again, to better inform and empower, that's what this conversation is the start of for today. Now, I also have to tell you before we go to our next presenter, this is just that reminder again. We want to remind our listeners that the information that we're sharing is an overview again about COVID, the vaccine, as well as the registration process. For medical information, please be sure to contact your doctor or your healthcare provider. So up next, again, we've gone through 2 levels. We've talked about the vaccination process. We've talked about the registration process. Yes, thank you for putting those up. Can you all show me that? That was 2, because remember I said there's 3 things. There's 3 things we're doing today. So we're on our last one. We're on our last one. And I'm an educator, y'all. So we take them in 3. So that's what we're doing here. The last part of this conversation we're going to be talking about is this grassroots effort. And so this part of our conversation, we know that things are happening. I mean, we know we have a vaccination that's out there. We know that there's a registration process that's happening out there. But now we need to talk about what is actually happening right in my next door. What's going on with respect to grassroots efforts? And so it is my pleasure to welcome as our next conversationalist, our very own and a friend of ours, Diane Stevens Robinson, who is the president and CEO of the Greater Stark County Urban League. Now, the mission of the Greater Stark County Urban League is to enable African Americans and the underserved to reach full economic, social, and health parity to enrich their lives and the lives of their families. Diane is a retired Hoover Company executive. She received her Master of Arts in Psychology from Cleveland State University and a Bachelor of Arts in Sociology from Howard University. Diane volunteers her service at a local, state, and national levels, and she has an extensive amount of volunteer service. So Ms. Diane, I didn't even put all that on there because your service is extensive. But one of the things we want to highlight about you is that you were awarded the United Way Golden Key Award for Outstanding Volunteers. And you were also inducted to the YWCA Women's Hall of Fame. You were also presented with the Founders Award by the Ohio Association of Community Colleges. Diane is a member of Mount Calvary Second Missionary Baptist Church. She and her husband, Preston, have 2 children and 10 grandchildren. Diane, thank you so much for joining our conversation today, because we know at this grassroots level, this is where it happens. This is the boots on the ground. As president, and as you think about this rollout here, as you think about this with the Greater Stark County Urban League, this process and the leveling, what are you hearing? What are you seeing? What should our listeners be knowing about in terms of this? So help us just kind of reconcile all of this. You know, we've heard this vaccination, we've heard the registration process, but I just want us to kind of just have this chat with everyone listening about this process and what you're seeing at a grassroots level. And if you can, if you're able to, tell us a little bit about what the Urban League is doing and how they're going to join in on this effort as well, because we know you have some exciting things in store.
Thank you. I do appreciate the opportunity to share some information with you. Good evening to everyone. And again, thanks to the Stark County Alumna Chapter of Delta Sigma Theta Sorority for their leadership and their fact that they know how important it is to share this information in community. Hey, and I have to begin by saying, wow, what a great job Jasmine Long did in helping us understand just what this COVID process is and how the vaccine impacts our bodies. And again, all of the information that we can get out to the people will help make the difference. And again, thanks to Cleo for the information with regard to us being able to register and how to go about that. But I am going to really, again, speak to that grassroots level and what's happening with the Urban League and the COVID vaccine. And I'm going to add a piece to it where the registration process is concerned. The Greater Stark County Urban League is working with the health department, with Jim Adams of the health department, and with Cleo. The fact that Cleo sits on that board makes a huge difference because she knows what's happening on a consistent basis and shares that information with our community. And as a result of this combined effort of all of us that have some contact in community, we have been able to really work with the health department so that they have assigned a number of registrations to the Urban League so that we can support their equity clinic project and really address that disproportionate number of African Americans that have been impacted with COVID. With this new registration process, they are allowing the Urban League to register individuals. And so if you know someone out there that does not feel comfortable with the registration process or not comfortable with registering online, they can call the Urban League and we will register them. At this point, we've probably registered somewhere around 65 individuals for the COVID vaccine. And we're still working on that and in the process. As of today, I have registered another 17 individuals that will be taking that COVID shot, that vaccine on February the 25th. And the shot will be given at the Civic Center on Market Avenue. There are many individuals that, again, are not comfortable with going online and signing up. There are requirements to that. And those requirements are that the individuals at this point be at least 65 years of age. And as Cleo mentioned, they have to live within the Canton city limits in order to qualify.
Mhm. Okay, Miss Diane, this was new. This is new what you just said. You just announced that the Urban League is doing this. This is boots on the ground. This is happening. And this is happening now that yes, I'm doing, we're all clapping. This is exciting news because just a few weeks ago, this was not happening. That wasn't in the works. So thank you, thank you, thank you, thank you, all of you for making that happen. And because you're right, to go downtown and to try to find a parking spot, and there was just a lot of nuances with that. But to be able to have this right in the heart of our city, right in our neighborhood, to be able to offer a vaccine right in our neighborhoods close by for folks, that equity issue, that's when we start creating equity. That's when we start opening up those opportunities. And that's what we were looking to do. So thank you so much. I know that this might be a shock for some others, but I just want you to repeat that again, because I know you said you've been registering people and that you're continuing to register people. So can you walk them through that process if they want to get registered and how they could go about coming to the Urban League to get their vaccination?
Okay, just a point of clarification, Diane. She's registering them to participate in the Canton City Public Health Vaccine.
Okay.
After tomorrow, we will have a date. After my board meeting tomorrow, we will have a date of when it's going to be offered at the Urban League.
Okay, so this was just me go ahead and just claiming it in advance. I'm just in advance here. I'm just claiming it already. Okay, so Monday the date will be there.
Yes.
Yes. The again, for clarification purposes, if anyone wants to register 65 years or older living in the Canton City area, they can call the Greater Stark County Urban League and we will register them for the vaccine. And that phone number is 330-754-1576. And I'll put that in the chat box so that if you know anyone that's 65 or older and they want to take the vaccine, just contact the Urban League. The other piece of that, though, is that there is a continuous evolution of what's happening in Stark County. Mm-hmm. And although we don't have a date for the vaccine to be given at the community center, there has been an agreement with the health department, the Canton Health Department, and an agreement with the mayor that we will have that vaccine given at the community center. We don't have a date, but isn't it beautiful? We have an inside contact, okay? Mm-hmm. And that inside contact continues to work with it. And so that really speaks to what makes a difference in the community. It's us working together, the collaboration of us coming together to make the difference. And again, hey, we have a doctor. Dr. Long, Jasmine here has given us information. We have Cleo working inside with the health department, and then the Urban League at a grassroots level. And so again, this is all very good. The date should be here soon. And as far as giving the vaccination, and we have a great facility for giving that vaccination. We have the community room and then we have the gym there. And so we have a great facility for it and easy parking and access, which I think too makes a difference. Yeah. The other things that the Urban League is doing is that we are conducting a food giveaway at the Urban League facility. Well, at the community center. And why does that make a difference where COVID is concerned? Because we know there is a food insecurity within our community as a result of COVID-19. And so we're able to address that food insecurity. And again, the collaboration has allowed us to work with the Delta Sigma Theta sorority, and they at all times were taking, giving the survey, taking information for individuals, and also passing out information, educational literature with regards to COVID. And so again, we are addressing COVID from that perspective. Another means that the Urban League is addressing COVID is that we're giving away bags that contain household items, cleaners, and etc., and hygiene items, because we found that there were individuals in community that did not have the funds to purchase those household cleaning and hygiene items. And so the Greater Stark County Urban League has given away about 3,200 bags that to community that contain those much needed cleaning items for homes, so that we can minimize the spread of COVID. Now, all of that is on that grassroots local basis, but I'm also going to share with you some work that the urban leagues of Ohio, and there are 7 urban leagues in Ohio, have come together. The CEOs, presidents of urban leagues have come together to meet and work with the governor's office so that we can help to bring about change also. And so a couple of the things that we have asked for really replicate what has happened in Canton already, such as the 20% set aside of COVID shots for the African American community, and also being able to give the vaccine in a primarily African American community location to make it easy for individuals to obtain their shots. And another ask that we've put in is that we are asking that the governor provide guidance to businesses to support employees that need to take off as a result of obtaining that vaccine shot. Many employers are not doing that. So we're putting in a request for that, because with the first one, you'll hear individuals say they had a sore arm, but the impact of COVID is different for everyone. And I'm sure our Dr. Long is going to tell us that that is the case. Well, some individuals go for that second vaccination and then they're not feeling well at all. And employers have not just said to them, okay, we understand and it is a day of illness and we're paying for that. So we, as a entire group of CEOs for the state, continue to meet with the governor's office to change that. As a matter of fact, we have a second meeting with the governor's office on Tuesday. And so those are some of the things that we're doing on a more global basis that would be all inclusive for urban leagues within Ohio. And we have 7 urban leagues here in Ohio. So I know I've shared a bit of information. Do you have any questions for me?
I actually am just I was writing some of this down because I think that this is all information that some of it could be new for others, but I wanted to kind of capture it under 2 levels. One was what was happening within our community itself and the work that you're currently doing at the Urban League that they're pushing out, which is by way of offering food because of the food insecurities, cleaning supplies to help stop the spread of COVID. And then you're also not only registering, but soon will be able to offer that vaccine right at your location, which has free parking. It's convenient. It's enough space for people. So that's happening at a local level. But then you've also shared with us what's happening at a state level with all of the other fellow urban leagues, which is respect to the set aside in terms of the number of vaccinations, giving guidance to businesses in terms of what it means for employees that receive the vaccination and the fact that they might need to take off, and that employers need to be sensitive to that fact. And also the notion of locations in terms of where these vaccines are being delivered and offered. So that's happening at a global level, at a state level. So based off of what you've provided to us, Ms. Diane, there's this 2-pronged approach that the Urban Leagues have been hitting to really ensure that we are shoring up the effects of COVID and that we are really trying to ensure equity and access to our communities of color. So thank you so much for sharing that information. Did I kind of capture that for you?
You did a
Okay.
great job in
All right.
capturing it.
Wonderful.
Very good.
We're
Krista,
gonna, yes,
just
ma'am.
one more thing of what Diane, I wanted to make sure everybody understood the difference. When you call the Urban League and you leave your name and number, Diane has a direct, that was 3 times,
Mhm.
registration line where she will register you directly for the 25th. So you don't have to wait and go through the process of what we just went through if you live in Canton City. If you call the Urban League, she has a direct connection and slots available to her to directly register you on the spot for your shot on Thursday, February the 25th.
So directly, the Urban League can directly register you so that you can directly have your shot directly on February 25th.
Right. Now, I don't know how many slots she has available.
Okay.
But I think when I was adding these together, it's about up to 80. I think she has like, I don't know, 100 and something. So if you know of people who live in Canton City over 65 or have one of those pre-existing conditions, call the Urban League, leave your name, leave their number, and she'll get them registered for the 25th.
Directly.
Yes.
So can we get that number also in the chat? And Dawn, did you get an opportunity to put that number in there? Okay.
The number has been posted on Facebook several times. We are on it over here. We got that. We got it.
I'm high-fiving you on that. So we have the phone number posted. We know that this is happening now. We have had this great conversation. Now, Dawn, I'm gonna hit back on you real quick. Do you have any questions that you see posted over in your chat?
I do. One of the questions is, do individuals need to go through a partner agency? And I think we just answered this one, to get household supplies, or can they contact the Urban League directly? And can you give dates and times that are most that people need to contact the Urban League if they're looking for those items, I guess is what they're looking for.
Yes, if they call the number that you've posted there, they can call the number, leave their information, and the hours are between 9 and 5 p.m. And we will get back with them. If we by chance miss a call, we will definitely get back with them. And the items will be available at the Urban League offices, which are there on Sherrick Road. You all know the community center, and the items will be there and available. And if there happens to be some problem in getting there, we will look at how we might be able to serve an area of individuals. But those household goods are available. And one of the big things that really made a difference is that at a time when there was no toilet paper and paper towels, can you believe that we were able to access those products and make sure that they were there for the people? And that's huge, because many of those individuals don't have the funds to purchase the items, and they tell us with the items being supplied to them that they can use those funds for other things, such as food and or for paying a bill. And so we know that's really important. Another piece that I didn't share is that we also work with an organization called the Diaper Bank. And for those individuals that need diapers, we also can supply diapers for those individuals too. And so the Diaper Bank donates the diapers to us, and when we give away the household goods and the hygiene items, if diapers are needed, we can also give diapers. And again, that's something that can't be purchased with their funds.
Wow, this is amazing. We have gotten off to I mean, I think that when we started this, we knew that our journey was going to take us threefold. We knew that we were going to have conversations related to the vaccine, but we also knew we were going to get this registration process. But I think rounding it out and hearing this grassroots level and this effort and what's happening now, that is so impactful so that we can take this information back to our family and friends. So one of the things that we want to make sure we get everybody's attention on, because this is so important also, as we're having this conversation, is that folks understand that this is also a call to action too. Part of our conversation today was to bring this information to you, but it was also to bring this call to action to everyone so that you're aware of everything that is happening within our community. But now that you know, as Maya Angelou says, when you know better, you do better. So we all are knowing better now because we've learned about the vaccination process. We've learned about the registration process. And now we know that what's happening through the Urban League and the registration process that they're having, not only the registration process, we also know that there's other things that the Urban League is doing, not at just the local level, but also at a global statewide level. So we can share this information with our family, our friends, and all of our colleagues that we may work with. So the question is what is our call to action? What will you do now that you know the facts? What will you do? Will you share this information with others? Will you tell others to say, hey, you know what? I've seen the registration process, or I know that the Urban League is taking registration and at some point they're going to be offering vaccinations, or better yet, I know the Urban League is giving away food, or that they're giving away cleaning supplies, that whether you live in Alliance, Canton City, Massillon, or you want to go through the health department, that the registration process is not all that hard. We wanted to put up some of the links here for you as well so that you could see them again. But again, the question is what will you do? What will you do with what you know? So this has been, I think, Dawn, a great conversation. All of our sisters that have been on here. And I would be remiss if I didn't.
One other question.
Oh, you got another question? Because I'm going to do the disclaimer again before we close out. Okay. So you go ahead and you bring that question up. And as you're doing that, I'm going to go to get that disclaimer ready.
And the only reason I want to get this out there is because we've talked about Canton City, but there was a question about, and we know that the Canton Urban League is working with in Canton, but the question was, is there going to be an opportunity for a Massillon and Alliance to have that same equity that Canton is being offered through the Urban League, as far as having a designated space and time, date and time to get the vaccine in their community? So I'm gonna.
At this point, we do not have that commitment from the Massillon nor Alliance health departments, but we're working towards it because that is one of the reasons we're working from a statewide level so that it will be passed down to all of the health departments so that we will have that equity set aside percentage. And so I look forward to the opportunity of getting back with you to say, hey, it's statewide and you can go to that group. Now, I am hopeful that I'm pretty sure they will give it to the Urban League because we are the greater Stark County Urban League and we serve Massillon and Alliance. And so again, my expectation is that the Urban League will be able to register individuals throughout Stark County.
Mm-hmm. Thank you so much. Dawn, any other questions?
No other questions. No other questions.
Wow, I think we were really thorough. We did 3 things, everyone, right? What were the 3 things? We talked about the vaccination, check. We talked about the registration process, check. We talked about our grassroots level and our state level efforts, check. We handled all 3 of those things all in one setting. And Dawn, it's always a pleasure to tag team with you. So high five, Dawn.
High five.
High five. We want to thank all of our sisters that have joined us, also from the Stark County Alumni Chapter, all of our many community members that are part of this as well and part of this conversation. We hope that you will share what you've learned again with others. And we want to give a special thanks to our presenters today, Jasmine, Cleo, and Diane, because you have brought a wealth of information to us. And without your knowledge, we would not have known these things. We've gotten better because of you. So thank you so much for letting us get better. And we just want to thank all of you for joining our virtual conversation, Know the Facts, a conversation on COVID-19. Again, this has been sponsored by the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Again, for more information, please contact your medical or healthcare provider or the other health departments that we've listed here. It's been a pleasure talking with all of you today. Thank you so much. Be well, be safe, wear your mask, and remember, we are all in this together. Thank you so much and have a wonderful evening. Be blessed.
Thank you.
Good
Thank
night,
you.
everybody.
Good
Great
night.
job.
Great job. Thank you.
Oh, very good.